Well, welcome everyone. I think we have some folks still coming into the room, but we're so glad that you are here this evening for our webinar and panel discussion. We have the pleasure and really interesting opportunity tonight to be able to watch Ernie and Joe Crisis Cops, or an excerpt from it, as well as to be able to actually hear from Ernie Stevens, as well as a group of panelists here as well. The evening will really have those two parts to it. We'll dive in and see a 25-minute portion of Ernie and Joe, the Crisis Cops, which is an intimate portrait of two Texas police officers who helped to change the way police respond to mental health calls. The film takes us on a personal journey, and we'll be able to weave together Ernie and Joe's experiences during their daily encounters with crisis, and learn how they really developed the San Antonio Police Department's mental health unit. And then we will have, as I said, a short panel discussion featuring Ernie Stevens and some other folks here locally. So I think we're going to jump right in here and begin the movie. So I'm going to hand it over to our technical experts to begin. Well, that was certainly a powerful excerpt from the film, and I'm so glad we all have had a chance to see that. And as we move into the next part of our evening here, as I mentioned, we're gonna have a chance to hear from Ernie Stevens in just a moment, as well as some of our other panelists here. I just wanted to do some housekeeping before we switched gears. We are going to be taking any questions and answers in the Q&A box. You'll notice in the bottom of your screen there should be a Q&A box, and there put in your questions. We're not monitoring the chat, so please put any questions that you have in that Q&A box, and you can do that as we go along. Just as a reminder, we're going to hear from each of the panelists. They're going to just share a little bit about their experience, and we'll go through all of those, and then at the end of that time we will take a look at the questions and begin to do the answers. So it's my honor to introduce Ernie Stevens from the movie that you just saw. He served as a police officer for over 28 years, recently retired from the San Antonio Police Department, where he served for 25 and a half years. He is the founding member of the San Antonio Mental Health Unit, and he holds a bachelor's degree in criminal justice. He's been on Nightline, and he's been featured on NBC's A Different Kind of Force. Of course, he's on the Emmy Award-winning HBO documentary Ernie and Joe. He's currently training other police officers in crisis intervention training, as well as law enforcement trainer for the Naval Security Forces. So I'm going to hand it over to Ernie now, and we could say thank you so much.
Well, thank you. It is an honor and a pleasure to be here. Anytime that I see NAMI's name attached to a screening, I get super excited, and for a few reasons, right? I was a board of director here in NAMI San Antonio for several years, and NAMI was instrumental in getting a mental health unit started for the San Antonio Police Department. And I do want to mention one thing before we get in the conversation. I know that at the very beginning of the film, there was an event that took place with an officer-involved shooting. And I just want you to know that, you are here amongst friends and family if you're with NAMI. And if you need to reach out and talk about that, you have support available. And, the documentary is very straightforward. Things happen like this in life, and NAMI comes together as a grassroots organization, and they're there to support and advocate for members of the community. So I couldn't be more thrilled than to be associated with NAMI. I look forward to the walk every single year, and I'm so thankful that they're a part of this screening tonight. I do thank you for taking the time out of your evening to spend an hour with us talking about mental health, continuing the conversation, and really trying to break down the stigma about mental health and how it relates to just our everyday lives. You know, in law enforcement, it's a very difficult subject to even discuss. And I know we have some panelists here in law enforcement, and I'm hoping that the film really humanizes the badge and what's behind it. And that's just, there's a human being behind that badge. And, you know, in 2019, we had 238 officers commit suicide. And in law enforcement, officers are killing themselves at a rate of 3 to 1, you know, versus dying in the line of duty by violent means. So, you know, across the spectrum, members of the community, members of law enforcement, we have an obligation to continue to talk about mental health and to break the stigma and make it okay to not be okay. It's just not okay to stay that way, and to be able to ask for help and really revamp what the definition of resiliency and tough means. You know, you look up the definition of resiliency and, you know, pull yourself up by the bootstraps. Are you able to come back from a tough situation? You know, now I teach Navy recruits that are police officers, and I tell you, you know, resiliency and being tough is doing the difficult part and raising your hand and saying, I need some help. I'm not doing okay today. I'm struggling with something. We really need to redefine that as we go forward, and we reshape and revamp training within our police departments. You know, the community has been has been heard and has been very outspoken on what they expect from law enforcement and the type of response that law enforcement has when it comes to a mental health crisis. So as law enforcement, you know, I, for one, am listening. I'm changing the way things are done in the military. I'm about to embark on another adventure here that I was just offered an opportunity today, and it's going to revamp the way officer wellness and cultures are put together. So, you know, it's such an honor to be able to discuss mental health with communities. I'm so glad that we're getting the support of so many different NAMI organizations and law enforcement organizations from all across the United States. We've talked to over 30 different countries who have screened this film, and the discussion is straightforward and real, and it's raw, which I love. You know, we're not trying to sugarcoat anything. We're all trying to come together for a common good. And that's what I think this film has done. It's not a blueprint on how things should be done, but it's a film on human connection and the importance of that. So, you know, I look forward to the Q&A for tonight. I could go on and talk for a while, but I think for your benefit and for the value of this Zoom webinar, I would really like to interact with you on a one-on-one basis. If you have any questions to put out there, I'll do my best to answer them. And I'm looking forward to hearing from the rest of the panelists. So thank you, NAMI Maine. It's an honor to be here tonight, and I look forward to this. Thank you.
Wonderful. Thank you so much. And yeah, we will get to those questions and answers pretty soon. I wanted to first introduce one of the other panelists, Chief Eliot Moya here in Eliot, Maine. So he was born in Brooklyn, New York, and grew up in Western Massachusetts. And after moving to Maine, he joined the Eliot Police Department in 2007 as a sworn officer. He worked in patrol, field training, and investigations before being promoted to lieutenant in 2014, and then becoming Eliot's sixth chief of police in 2016. So welcome, Chief Moya.
Thanks, Robert. Appreciate the intro there. Robert and I have been doing a lot of these Zooms lately, and so hopefully we're starting to get good at these things. Ernie, what an honor to have you join us. The work that you've done and continue to do is amazing, especially with you know, Jennifer McShane capturing some of that work in this documentary is truly remarkable and inspiring. Every time I watch it, it doesn't get old for me. So
Thank you, Chief.
I do appreciate you. I can't say it enough how much I appreciate you being here. But besides talking about this great documentary, I want to talk about why you know, I felt compelled to bring us together and host this event. And the simple answer is that I wanted to. I guess I thought this would be an impactful way to bring this issue to the forefront here in Southern Maine. You know, law enforcement, mental health responses certainly isn't a new issue. And I don't know that us as a small agency here in Southern Maine are doing anything particularly groundbreaking. But, as we started down this path of CIT, we've experienced some successes and challenges, and I foresee more of both ahead. But we are committed to continue this path forward. And I want to talk about a little bit about how our kind of focused CIT story began, because it kind of comes as a positive from the challenges of the pandemic. I was asked multiple times if we could determine specifically how school-age children and families were handling being at home, going to school, families going to work remotely versus being in the brick and mortar buildings. And the concern was that cases of abuse or mental health issues were going unnoticed or unreported, because families basically no longer had the supports of school teachers, watchful eyes of coaches, teachers, et cetera, clergy. And I didn't have an answer to that. Of course, what do we always do? We turn to the data and we try to see, some kind of trend. And we didn't have any kind of, trend that specifically pointed to any kind of really mental health well-being in our records management. So it was a conversation worth having. And so we brought it to the department, and I credit, one of our officers that I give a lot of credit to pushing me to move towards a CIT is Adam Watson, because he just was relentless on suggesting, hey, we got to do this. And the important thing was that we already had, the majority of us were already trained. We just, as an agency, weren't doing anything effective with the training. So it was just something that we had to check off a box. That was really resonating with me. I remember talking to, the Sergeant Ron Lund and saying something along the lines of, the more I look into this, the CIT stuff seems to make sense. It seems important and we need to do this. It was that point he agreed, and he said, have you ever watched Ernie and Joe Crisis Cops? And that's kind of what got me to watch this at first. And when I said earlier that it was inspiring, I truly mean it. The rest from there is history. We started and we really haven't looked back. And at the start of this formalizing, a crisis intervention team, I did not know where to start. No clue. And I tried to seek some guidance from area departments. I know that there are some departments, larger departments in Maine, doing some really great stuff. But I couldn't find any information on departments of a similar makeup to ours that had a really formalized process that we could, either copy and try to enhance or anything like that. So we ended up connecting with NAMI Maine, specifically Hannah Longley, who you'll hear from here in a little bit. And I got, such excellent guidance from her. She made it feel simple. What was kind of overwhelming in my mind of how we're going to do this, she made it seem simple, and we just started. So we started by tracking mental health calls and reports, which was absolutely eye-opening. We're a small agency that doesn't have overwhelming, calls for service per year. But when you start looking at what's repetitive, it was very surprising to see that some of these mental health or calls with mental health element were repetitive. And essentially, our response was kind of triaging it and putting out the fire, but there was no actual long-lasting resolution. So that was something we identified quickly and knew we had to work on. So while we didn't have a formalized approach, we used our core values as a guide. We had, an openness to learn, and we quickly adapted to a shift in our culture. And our commitment so far to CIT has already produced some really powerful experiences that only proves that this is worth it. Not only to me, but the guys on the road are seeing that all the time. So as an example, one of the really simple things that we did was started by assigning a CIT trained officer to follow up on some of our mental health calls. They simply would check in. They'd pop over when in a time where maybe the call wasn't so chaotic. It was just a follow up so that they can offer some more resources, a time to talk and kind of when things were were settled. That has grown into Sweetser Mobile Crisis, who you'll hear from one of their representatives here shortly also, one of their crisis workers riding along from time to time. And when we were able to have them ride along, they'd help us with any calls that came in, but they were also there to help us follow up. And that has been just absolutely invaluable. It's clear that this is an evolving process, and we have a lot to learn. I said before, we're committed. One of the important parts of having a mobile crisis worker with us has been the learning between the crisis worker and the police officer. We realized that we didn't quite know each other's role, which was often kind of a struggle. It led to some frustration and even some miscommunication. So, as we continue to work together, one of the real benefits that we've seen so far is that, we're uniting, we're learning, and we're starting to respect what each other's roles are. And then that's what's making the response much more effective. So is this perfect yet? No, absolutely not. But we are, I feel like we're moving in the right direction. Certainly need more committed partnerships and possibly from some people who are in attendance tonight. I've heard from some people already who have signed up and are hopefully here, already reaching out saying, hey, this is how we can help. So, with that help is how we can ultimately, better serve our community. So with that, thank you. Thank you again, Ernie. Thank you everybody for being here, and I'll pass it back to Robert.
Wonderful. Thank you so much, Chief Moya. And so yeah, now actually we get to hear from Hannah Longley from NAMI Maine. Introducing her, she's a licensed clinical social worker with 15 years of clinical experience. She has many years working in crisis services. She was a technical manager for crisis services for the Kennebec and Somerset counties. During this work, she worked collaboratively with community providers and first responders in planning and responding. She also provided mental health support for first responders. She was then contracted as a psychological health coordinator with the Maine Army National Guard prior to coming to NAMI Maine. Her work includes working with first responders across the state in implementing the crisis intervention team, CIT, mental health first aid, and programming involving mental health first responders and veterans. She's a member of the International Critical Incident Stress Foundation and a nationally approved instructor for critical incident stress management for individuals and groups, as well as a certified mental health first aid instructor. Welcome, Hannah.
Thank you, Robert. I feel like NAMI has gotten quite the setup coming into this. For folks who don't know, NAMI is the National Alliance of Mental Illness. Here in Maine, we have actually one of the largest chapters, which is pretty exciting because we're one of the smaller or least populated states. And it started as a grassroots organization of moms who wanted support and advocacy and education for their children who live with a severe and persistent mental illness. And that's really what NAMI has grown to do and really what we work to combat. And through this work, it's wonderful. I've been attached to CIT for a number of years, 3 years. I've been with NAMI Maine overseeing as the Director of Community Programs. And it's important work here in Maine. At the beginning of the video, you saw that 1 in 5 Americans receive treatment or live with a mental health diagnosis in a given year. Here in the state of Maine, it's actually 1 in 4. We have the highest percentage of young people who are diagnosed with anxiety disorders in the nation. We're the 3rd highest percentage of young people who are diagnosed with depressive disorders. So we really try and push forward that as our mission in looking at those 1 in 4 Mainers. And in doing this work, we really look at CIT as being an integral part of our programming and how important it is. There's a lot of information out there that leads to a huge stigma surrounding mental illness, particularly severe and persistent mental illness. The statistics tell us that someone with a severe and persistent mental illness is actually 11 times more likely to be the victim of a crime than they are to perpetrate a crime. And if we eliminated the impact of mental illness on the violent crime rate nationally, we'd only reduce it by about 3 to 4%. So we really want to put that out there to really start talking about how we can have more robust mental health services and responses and supporting and really starting to separate out from the criminal justice system. I saw a lot of questions in the Q&A box about what is CIT. CIT is Crisis Intervention Team. It's a model that originated out of Memphis, Tennessee in 1988. There was a high-profile shooting in Memphis, and there was a public outcry. And there was a lot of questions as to what were some of the impacts on the lethal use of force and then lethal use of force as a whole within the police department. And so Memphis Police Department really held a mirror up to their face and did a really deep dig into their records. And what they found was one of the common denominators in their use of force, particularly a lethal use of force, it was the presence of a mental illness or a mental health crisis. And so they teamed up with NAMI Memphis and with the University of Tennessee at Memphis, the University of Memphis, and then their mental health providers and said, what can we do that's better? And with that, they put forward the CIT program. And it's really a community-based program where we have lots of different steps and measures that we put into place with the real kind of immediate goals are looking at reducing the injury to the individual in crisis and to the officer, just creating a safer response and decreasing use of force. And then also really looking at diverting from higher levels of care. So trying to divert individuals from the county jails. Nationally, county jails have been some of our largest providers of mental health services. And again, that's a national, and here in the state of Maine, it holds true too. So how do we get individuals who are struggling with their mental health out of the criminal justice system and stop criminalizing it and start building up really robust response systems? Maine is a rural state. I think we're designated 60% rural. So we're over half of our state is still a very rural population. And so what we're working hard to do is to take these great big city models, because we don't have the capacity in most of our departments to have a mental health unit. It would be amazing, but that's not the reality of where we are. And so how do we take these models and come up with regional teams and implement regional teams where we're bringing in the mental health providers, community and resources, law enforcement, families and peers, they have a critical voice in this and being able to understand and to develop a coordinated system where we're working together, we're working collaboratively in order to support the individuals in our communities. And so this does include, everyone thinks CIT is crisis intervention training. It's not, it's the team, but there is training that we have selected officers who go through and participate in, where we talk a lot about signs and symptoms of different mental health diagnoses. We work significantly on de-escalation skills, verbal de-escalation skills. We have families and peers come in throughout the week and share their stories and their experiences. And then we work hard that each section is taught by a community resource that's a tangible resource that officers on the street can take and then be able to provide it and utilize it when they're responding, either in that moment or to follow up. And so having those moments of follow up and building that trust and building those relationships and how best to respond to an individual who's having a crisis and experiencing a crisis. And as much as we would love to have the specialty teams, and Ernie, you can correct me, it's been a couple months since I saw the movie. And so, but the statistic that stuck out to me was I think only 3 to 5% of the mental health calls that your entire department responds to are handled by the mental health unit.
Yes, that's correct. We have about 25,000 calls a year for mental health and only 10 officers, which are doubled up. So 5 teams to respond to those.
Mm-hmm. And so I think that that's really, you know, when we think about the system we want to build, is keeping in mind that we have these great teams, but how do we, again, collaborate with all of the community resources to try and divert from law enforcement and try to divert to appropriate resources within the system that can help better support an individual. I always give the explanation, if you're having a heart attack, you don't want law enforcement to respond to your living room. I mean, they all know first aid and CPR, but I really would rather have the EMS guy with the defibrillator show up and respond to me if that's happening. And so how do we build a better partnership and system that we can respond together when we're going out and when we're working with folks, and again, responding appropriately with the appropriate services. And I think that the chief has really embraced the idea, which is wonderful. He just kind of called me and said, I don't know what to do. And so really just how do we bring everyone together and work together to best support our system and support our communities and what we're doing. I will put as a note is that we do finish up every CIT week with discussion about officer wellness. And I think that that's really important. And Ernie, I love the fact that you talk about that. And Joe is very open about it because it's imperative. The last statistics I saw for 2021, we have lost 61. There's documented 61 cases of law enforcement who have lost their life to suicide just in, again, this calendar year. And so we do know that law enforcement is one of the highest risk professions for dying of suicide. And so really trying to make sure that officers are taking care of themselves so that they're able to better take care of their community. And so I think my time is coming to an end. And so Robert, I'm going to shift it back up to you and then see if there's any questions later on in the session.
Wonderful. Well, thank you so much. And yes, we have one more panelist who we're going to hear from, and then we'll jump into questions. Jamie Baberick is an independent licensed professional counselor in the state of Maine and a certified clinical supervisor. She holds a master's in clinical counseling from Bellevue University in 2012. She provides therapy services for 10 years in outpatient, in-home, and treatment settings. And she's currently the clinical supervisor for Sweetser's mobile crisis team, which is working with the Eliot Police Department. So, turn it over to Jamie.
Thank you, Robert. So for those of you who don't know, Sweetser is a nonprofit community mental health provider with statewide network of care. So we offer community-based services for people of all ages, including mental health and behavioral health, and then also intellectual and developmental disabilities, recovery and case management, along with an education and eating disorders. So under the crisis umbrella, we have multiple different programs, one of which is a crisis stabilization unit, which provides the short-term therapeutic placement for someone experiencing a mental health crisis. And then under mobile, we have over half of the counties in Maine, and people can access those services by calling the Maine State Crisis Line. And then my team will be dispatched out to complete a comprehensive crisis assessment for risk and lethality, and then create appropriate referrals to any level of cares that they need, including remaining in the home, getting referrals to new providers, maybe going to that crisis stabilization unit, or even inpatient level of care. Over the past year, we've seen an increase in stress and uncertainty, and it's been exacerbated by feelings of fear and loneliness. But I would say that a silver lining of the COVID pandemic has been raising the awareness of mental health and reducing the stigma associated with that. During this time, we have focused on reaching out to different law enforcement and providers, and we've made connections and established relationships with various law enforcement agencies, Eliot being one of the strong ones. And so we decided to bring that together, and we do ride-alongs like Chief Eliot talked about. And during those ride-alongs, Crisis provides law enforcement and also community members education on the crisis services and other local resources. We've also been responding to local mental health calls with Crisis and the PD. And we've had really good insight into feedback that it goes well, and people have just gained more access to the services that we have to offer. So I'm really excited to see where we can go forward with this opportunity. And with that, I will turn it back to Robert.
Well, wonderful. Thank you so much, Jamie. And I'll invite everyone to come back on screen here, and we'll explore some questions and get the conversation continuing to go. So I think the first one we wanted to ask of you, Ernie, is sort of what was the turning point when you realized the beneficial approach to this approach to mental health calls?
To be honest with you, I'm going to give NAMI a lot of the credit here because when I got signed up to go to the training, it was my day off and I didn't want to go. I was forced into it. And when you work night shift, when you go to training, then you go to a daylight schedule for a week and you get the weekend off. So really, it was a kind of a crapshoot for me knowing that I was going to go to daylight schedule for a week. Little did I know that was going to change my entire career path, because what did it for me was a member of NAMI, a NAMI mommy, right? That came and talked about, her child that had mental illness. Now, granted, her child's 50 years old. She was in her 70s, but she was reserved to the fact that she was going to call the police and the police were going to show up and most likely end up killing her son, being involved in a shooting, because they wouldn't understand his behaviors. They wouldn't understand why he's setting fires in the garage, or why he's taking her engine apart at night, or why he's burning the dog, and that he hates the police. And the moment he sees them, he becomes enraged. And I sat there and I listened to what she said for a moment as a student. And I thought, how can a parent stand up there in front of a group of police officers and say, you may have to come to my house and shoot my son, but if you do, it's okay, because I know that you have a family to go home to. And it was that moment right there where I had that aha moment where something needed to be done differently in San Antonio. The antiquated way of responding to mental health calls in this community could no longer go on that way. That we would have to partner immediately with NAMI and other stakeholders and figure out a way to create a specialized unit who could go out in the community and give the community a response that, number one, they could appreciate, but number two, that would be effective and beneficial. So it was really, I'm going to be honest, it was God's divine mercy that put me in that class where I didn't want to be, and put Ms. Janine Owens up in front of the class, who was very vulnerable about her life and very straightforward with what she thought the outcome was going to be, that shot an arrow through my heart that said, I no longer want to be on the gang unit. I don't want to kick in doors. I don't want to do all the sexy stuff that police officers do on TV. I want to do everything I can to learn about mental health to where she doesn't have to feel scared to pick up the phone and call the police.
Well, thank you so much for that. We wanted to actually ask Hannah a question a little bit to sort of think a little bit about what are the resources that NAMI Maine offers our local communities.
Yeah, we have multiple resources. Our primary focuses are education. So we offer a number of trainings. They have gone virtual. I would like to say I'm a Zoom pro now, but not 100%. But we are offering a number of trainings just in the community. We offer family-to-family classes, which is for family members who have a loved one who experiences a mental health challenge and how to support them. We have the Waterville Peer Recovery Center, which are peer-based groups that we offer Monday through Friday. They have a ton of groups on there. I can't even begin to list them all, but they're virtual, and so anyone can participate anywhere in the state. We have mental health first aid courses that are being offered frequently, both adult and youth. We have public safety specific ones, and then we do offer veteran specific ones as well. So again, and gatekeeper and suicide prevention trainings also for schools, for clinicians, for community members. So we have a lot of trainings. If you go to namimaine.org, you'll see our calendar and you'll be able to see all of those that we're offering. We also offer advocacy and resources. We operate a helpline that is 8 to 4, Monday through Friday. It is staffed by River, who is a lovely, lovely individual and does everything they can to locate different resources across the state. If they're unable to, then we work collaboratively as a team within the agency, and usually with all of our heads put together, we can think of something. And then we offer a number of our first responder programs, again, where we offer CIT. because we don't have the luxury of large departments and specialty units, we have a CIT regional unit, our regional group in every single region. We have 8 chiefs regions, so we divided up into 8 regions across the state where we meet on a quarterly basis. All of that is listed on our website also, and please feel free to reach out to me. All my contact information is on the website, and we would love to get more folks who are involved. Again, the more resources that we can bring together and the more community members we can bring together, the more robust responses we can have.
Wonderful. Well, thank you so much, Hannah, for sharing that. And one of the things that sort of came up as a theme, it seems like, is really about officer wellness. So I was wondering, Chief Moya, if you know what the Eliot PD has been offering its police in terms of wellness.
Good question, Robert. We're a work in progress, but I will say we've tried some things, you know, and you know, right now I think what we're doing is just researching the stuff that's out there. I've heard of you know, some applications out there that are available that will you know, connect the officers to different resources. We've tried yoga. I don't know you know, how the guys well, some guys enjoyed it. I did. I know the Sarge did. We did that for quite a while, and we should probably do that again. We've done a couple of workshops, just trying to get the guys more familiarized with working out. I'm a meditator. That's what helped me and got me here. So we're definitely a work in progress, but you know, it is something that we are you know, going to focus on. But you know, we got to start somewhere. And you know, like Ernie just said a little while ago, I you know, this, and Hannah will attest to this too, is this was, for me, I wasn't sold on this, you know, and I can go back to like when I went to the academy. If you tried to send me to CIT training, I'd be like, you know, not for me. And for me, it was kind of the turning point of when I was a detective, that you really had to realize, you know, that, you know, being empathetic and having some compassion is really what was solving cases, you know, being you know, humanizing the badge, as Ernie said, and that you know, kind of stuck with me. And now here we are, and this is great. I'm not looking back.
Wonderful. Well, thank you for that, Chief.
I can add, we do actually have a number of, because I know that we do have a number of law enforcement officers who are here watching as well. And we do have resources that we're building and developing throughout the state. We have worked on, we call it our cultural competency in law enforcement. So we have trained a number of clinicians across the state in working specifically with law enforcement officers. And we vetted them and made sure that they had a good understanding of the individuals that they would be working with. And we're also working on developing a peer support team for law enforcement across the state as well, to be able to provide both individual and group debriefings. So if any officers need that, again, just visit the NAMI Maine website, and we have all of that listed there.
Wonderful. Thank you so much. Wondering a little bit, for a question for Jamie, actually, about sort of if you could share a little bit more about how the Sweetser Mobile Crisis Unit works and how they help support local police departments.
That's a great question. So as far as how Mobile Crisis Unit works is we get calls in from the community or from law enforcement directly, and we get dispatched out to go meet with people that are having a mental health crisis. So that could look like anything from suicidality to just an acute stress. How we intertwine with the police department is we will have them come out to do co-response with us. If they call us, we go out to co-respond with them. And once my mobile team gets there, they do a comprehensive crisis assessment, which identifies all of the current stressors and risk factors. And then we talk it through with the client or the client and their parents or guardian and determine what the best level of care for them is. And that would be the remaining home in the community, or if they want resources to new therapists or medication providers. And then we also have the next step up, which is like the crisis stabilization unit. And then also we can refer to inpatient hospitalization if they do meet that level of care.
Excellent. Well, thank you so much for giving the background on that. And I guess we have a lot of good questions here, so we're going to try and tackle as many as we can as we go through. But we have one in here in particular about how can we help administration and staff in schools? This is from Karen Wade, who's a high school counselor, better understand the role of SROs in mental health response. Coming from the perspective of many people look to counselors and social workers as mental health responders, and the SRO as the discipline responder. I believe we do our best work when our responses are coordinated and collaborative, and best in helping the staff understand what's going on. So I guess if I could just open it up for thoughts from anyone on the panel, actually, to sort of tackle that.
One of the biggest things that we push through our CIT program is that when you are working on developing crisis plans as providers, as mental health providers, we take lead on developing our crisis plans. Is that we work with the family, we make sure that it's very individually driven and centered. But one of the things that I always try and push and try and remember, again, both as a clinician and then also as someone in the CIT world, is that if we're going to put law enforcement down as a crisis response, we need to collaboratively make the plan with them. So if you are developing a crisis plan that utilizes law enforcement kind of as the last resort, make sure they have a clear understanding of what you're asking of them, but also make sure they have a clear understanding of the individual that they're responding to. So we want to make sure that we're setting everyone up to be able to respond in a very supportive, empathetic way, and not just wait until there are those times that you feel like they have to come in as the disciplinarian. Allow them times to develop a relationship in non-crisis moments, but again, work with them on understanding what their role is and what you're asking of them when they become involved, as well as when you know, them understanding what you're asking for and what your role is. So we all have very defined roles, but we also have a lot of roles that overlap. And so I think the more we can communicate and collaborate in those moments, the more positive outcomes we see in those crisis moments.
Other thoughts on that question before we move on from the panel? Or
I'll jump in and say this. What we did here in San Antonio was we came up with a 40-hour CCIT class, Children's in Crisis Intervention Training. So we did a 40-hour class with SROs, school administrators, nurses, and counselors. And we invited them basically to a 40-hour CIT class with the specific focus on adolescent behavior. And then we used adolescent role players throughout the week to team up an officer with an administrator to see how they would respond to a child in crisis. And actually what we found were some of the officers had already received CIT training, so they were more focused on the person and not the problem, where the administrator was more focused on correction instead of connection. So I think if you can get them to work together and come up with kind of a strategic plan of where you want to be in the future with your SROs, you'll see very quickly that by creating and establishing training where you're involving both the education system and law enforcement, and you can do the same thing with your fire department because they're responding to the same calls. Really, CIT works for any organization as long as the foundation is active listening de-escalation, right? So you see this in focus-based adolescent environments, and that's what we did here. And we've seen some really, really good success with this. And we've seen a reduction in kids that were being involuntarily detained and then being de-escalated, stabilized, calmed down, and sent back to class.
Oh, that's great. Great to hear that experience. One other question that came up actually for you, Ernie, as well, relates a little bit to uniforms. And so, you know, what are your thoughts on, is there a big difference between when you respond, you know, in uniform or in plain clothes, and what do you think that, you know, what do you think that should look differently in the future?
Well, we don't need no stinking badges, right? So for for us, when I actually, the chief chose me to pick a partner and say, hey, start up this mental health unit. This was back in 2008. So I wanted to develop a unit to where the community wouldn't be scared the moment we showed up, right? And I thought the easiest way to do that is, first of all, by changing your mere appearance. I mean, look at the way law enforcement dresses today. A lot of them have outer carry vests with a taser on the outside and shotgun shells and magazines for their pistols, and it's scary looking. Zip ties. I mean, it gets a little bit ridiculous with what you're starting to see out there. And if we can show up in just a polo shirt like what I'm wearing and a pair of jeans like you see in the documentary, if you think about the continuum of force, your very first show of force is your mere presence. So if we can remove that barrier of a uniform and show up in plain clothes, identify ourselves with our badge, and then put it away and say, hey, we're just here to talk to you, and you can help us understand what's going on out here. In 12 years being on the mental health unit, I didn't have one use of force in 12 years. And I dealt with the most psychotic people in the 7th largest city in the United States because I understood what I was dealing with. And number two, and if you go back and look at the part of the documentary where Joe and I are in uniform and we're trying to talk to Kendra on the bridge, immediately there was a barrier there. However, if you utilize the training properly and you take your time and you're patient and you try to empathize, and I heard the chief say that earlier, and Brene Brown has the best quote when it comes to empathy. She says, in order to empathize with someone's experience, you must be willing to believe them as they see it and not how you imagine their experience to be. So if you can show empathy, sit down, calm the situation down, don't be overbearing, and really try to understand what the person's going through, you can still meet these goals of crisis intervention, whether in your uniform or not. It just makes it more difficult because you're dealing with that barrier. So in my mind, it works great. I know that in a lot of departments, leadership is a little hesitant to do that, and for good reason, because you're showing up with, really unidentified. And sometimes people in crisis that are paranoid may think, hey, you're that person that's been following me or whatever. So I get it from a leadership standpoint, but I've also been out there. I've walked the walk for 12 years on this unit, and I've never had a use of force. So I know for a fact it was very successful in our program.
Well, thank you so much. That's really a lot to think about with that. I was wondering, we have to bring it back to the local level, or I guess that's the local level, right? But bring it back to the local level is a question for Chief Moya in particular, asking, what types of data do you track with your mental health follow-up calls, and how do these data drive ongoing quality improvement efforts in your department? So this is from George Schaller, from a senior research associate at the Muskie School Justice Policy Program.
Yeah, so this is, as I said before, a work in progress. This is something that we're starting to do, but what we're doing is we're using our records management system to, essentially mark off when a certain incident might have a mental health element, and if it does, then we will, if we do a follow-up, we'll code that follow-up as a crisis intervention. Part of us, if there are crimes involved and things like that, the federal government wants certain numbers, and so we wanted to be able to not track everything as a mental health, potentially incident, but we also didn't want to lose that. So we just kind of created within our system a way to just do a special report, and then with that, the officers now know, okay, there's an element to this that is mental health. So from there, we'll get beyond this issue. Hopefully it works out, and like I said earlier, kind of triage it, but then go back with a CIT trained officer that will, go, or even with mobile crisis if we can, and try to kind of work through a follow-up with more resources. So I hope that kind of answers. This is so new that I don't know that we really have any trends or anything specific. With that, also we are we forward our information to Hannah as well. And Hannah, you could probably speak to that a little bit as far as how you work with the data on that side.
We collect data from all CIT participating departments across the state, and then we pull it into a regional database. And so we look at it as a whole in the region to try and see if we can find any trends. Some of it is basic. Is there an injury that's incurred? So do we see that CIT officers, there's less likelihood for an injury to occur, or the disposition of the call? So are we actually diverting from higher levels of care? Are we transporting everyone to an emergency room, which is a trend that we're seeing currently? We look at referral sources of calls. And so we really try to look at how do we best coordinate responses based on that. And I apologize, we have 8 regions across the state, so memorizing the data points for each individual region is a little difficult because we did tailor it to each individual region and what their specific needs and goals are of their programming. York County is Region 1, and so Region 1 was really looking at trying to see where there's potential gaps in the system, which again, we work really closely with mobile triage and have brought them in. Poor Jamie, I think, is on everyone's speed dial these days, and trying to make sure that we're coordinating those community responses whenever possible. And then really looking at the referral sources and how we can best utilize community resources, and then where there are gaps in services. And so are there frequent utilizers of the presentations that utilize the system or are more likely to utilize 911 services? And so how do we then collaborate with the mental health system or other community resources to connect them? And again, divert from the law enforcement side of the house.
Wonderful. There's an interesting question, sort of. I guess really for the whole, anybody on the panel can answer this, but maybe Jamie could take the first tackle of it. But it's so what do you feel is the most important thing to remember when first responding to a mental health crisis? And this is, someone who's reached out for help. I hope officers in particular understand how important their actions and words can be.
Sure. So I think that one of the most powerful parts of this documentary for me was when they said the term "I see you." And so getting on that human level and understanding that it's just a person that you're standing next to, and it doesn't have to be defined by a mental health diagnosis or anything like that. I think that that is probably one of the most important things, and to just realize that you're there to help, and we have the resources that we can pull together in order to help the people access the services that they need. Chief Moya, what do you think?
Yeah, I completely agree. I mean, I think, as Ernie said, we come in with the outer carrier, the taser, so the biggest thing that we have to do is overcome that hurdle, and then, essentially convince them that we are there to help. And that can be a hurdle. So, again, we keep saying empathy, but there's a reason, right? So I think, I think we just kind of, work through that and make sure that the point gets across that we are truly there, to provide resources and to help.
I'll add my 2 cents, which really that's all I'm worth nowadays. But you understand what you're responding to, right? And I think a lot of that has to do with are your call takers trained, right? Are your dispatchers trained in CIT? We have a 24-hour course here for our telecommunicators on how to triage these calls. So the more that they understand mental health, the more they're able to give that information to the responding officer so they know exactly what they're dealing with. Then if the officers have the training and the understanding, then you know more or less kind of what you're walking into. And remember, these are medical emergencies, right? In some instances. So if you can change your mindset and not have a fixed mindset as an officer, but have a growth mindset of there's a bigger picture out there than everything can be solved by law enforcement, you may not be able to solve anything. You may be a step in the process to getting somebody to Jamie, to getting somebody hooked up with Hannah, right? If you can do that, I love what Harry Truman said. Who cares about this? Who cares who gets the spotlight as long as there's success out there, right? So it's all about the success of the program and not who's standing under the spotlight. You've got to collaborate and make this a multidisciplinary issue, and bring in your stakeholders and think about what's the common good for the community, and get your officers to buy in on the training, you know, and add specific elements to your training. We changed ours a whole bunch until we thought we could dial it in. You know, we added adverse childhood experiences, ACEs, which I think is very important for officers to understand. If they don't know about trauma and childhood trauma, how can they be a part of the solution in their community, right? Implementing procedural justice and letting them understand the difference between legitimacy versus statutory, and being really good at implicit bias training. So you can check that before you enter into a situation. There's so much that can be done. And I'm just thrilled that we're having this conversation. Like, you have no idea. Like, I'm getting goosebumps just talking about this stuff. I'm a nerdist. I'll be a nerd for mental health. I don't even care. But to see where you're at and to listening to your vision and who's on this Zoom right now, I'm following you on Twitter. I'm watching everything you're doing. And if I can ever be a help, I can't wait. Sorry, man. I'm loving this.
Well, that's wonderful. Well, I think sort of tied to that, to the excitement of doing all of this, of course, comes a question that one of our folks watching is asking, which is about money. And so, you know, how do you convince towns and cities to invest the money that's needed for the crisis intervention teams within their respective police departments, and maybe it goes beyond that as well. So really open for the panel, but I'm sure all of you have thoughts about that.
I'm going to be honest, we turn to Texas a lot. Texas has implemented a lot of either promising practices or best practices that have emerged as it relates to crisis response, and they have done a great job tracking how much money they've saved. So we rely on their kind of trial and error and information in a lot of ways. Right now, we are funded, the state of Maine does fund CIT program implementation for we have 3 full weeks that we offer across the state. Then we have 3 refreshers that we offer, as well as other individualized trainings and work that we do as it relates to implementing the program and bringing all of the communities together. There are a lot of different creative grants that are out there. And then also I think that just as we're collecting the data, we're finding a lot of departments are able to really look at different funding sources within their municipalities and be able, again, the data, I think, was one of the most difficult things to get people on board in agreeing to do, at least because it is an extra step. It is an extra level of work for people who are already really busy and stressed. But what we ended up finding is that with the data that we're collecting, and again, why it's regionalized, is that they were able to justify looking at the data and the call volume and the amount of time it was taking, that it was cost effective to be able to add additional resources or services or supports, again, because it's more cost effective. And it's best practice. It's what's best for their community. So it's not only the nickel and dime part of it, but it's just the human dignity and respect and compassion that we can offer them as well.
Yeah, so many programs, right? If you look at it, if it don't make dollars, then it don't make sense, right? So just go to the police department, Chief Moya, y'all got all the money, you can make it rain, right? But in reality, what we did here, we had our stakeholders, especially our hospital systems. We did a study on the safety net population, those that were uninsured that were coming into the hospitals with mental health issues, and seeing what it cost the actual hospitals to treat these patients, right? And what they found was, look, if we can be proactive about this, we had our hospital systems pitch in $1.2 million, and we created a proactive system where we paired an officer with a clinician and a case manager, and we went out, and because it wasn't grant funded, the money wasn't earmarked for anything in specific, we identified the top 100 utilizers in San Antonio, and we pre-engaged them and said, hey, we are a team, a multidisciplinary team that can help you. What is the issue? Why do you keep ending up in the hospital? You don't have a provider? No problem. We've got one. The local mental health authority has agreed to let the psychiatrist treat the top 100 patients. What else is the issue? Medications, no problem. We have a budget for that. Transportation, hey, I'm your Uber driver from this point forward to make sure that you get to your appointments. You need ID recovery, we're going to get you ID recovery. Food stamps, Social Security, it goes on and on. And who's paying for this? The hospitals, because it's a lot cheaper for us to pre-engage the crisis and keep them out of the emergency rooms than it is for them to show up uninsured and run up huge hospital bills. And really, there's no follow-up once they're discharged, and it's just a rotating door. So if we can get in there and put a wedge, you know, where that gap is, and say, let's provide some wraparound services, what we've seen was a huge decline in these emergency detentions. So reach out to your stakeholders. Everybody's a part of the community, and you really need the entire community to address this issue.
Well, wonderful. I think we have we're getting close to the end. I know we've got a lot more questions. We won't be able to answer all of them, but I think that we're going to share some resources at the end, and hopefully this is an ongoing conversation for all of us. But here's a question from Tanya Pearson, and it said, you know, it's a fabulous start to the ongoing conversations. How can we make sure all law enforcement officers receive CIT training? And I'm wondering how Ernie and others feel we each can help change the stigma of mental illness within the criminal justice system. What's worked from your experience?
Well, when it comes to law enforcement, first of all, you have to have a leader like Chief Moya who says, we're going to make this a priority. You know, if we make this a priority and we want to send our officers to training, then you're in good shape. The state already down here in Texas has mandated mental health training. So in Texas right now, you're not required to do the 40-hour CIT, but you are required to do a 16-hour course and then an 8-hour refresher every quarter. However, because of the Sandra Bland Act, where a state trooper arrested an individual who ended up hanging herself in a jail cell, now they're required to take the 40-hour Sandra Bland de-escalation course, which has a lot of mental health components tied to it. So if they're taking, and this is all legislation, so that's really how you're going to get officers to do it. If they don't have the leadership that buys into this, then legislation is going to have to be what drives the training. But, you know, a lot of departments say, well, we can't afford to free up an officer for a whole week because we're small. The average police department is about 12 officers, you know, nationwide. So can you really give up an officer for 40 hours and have to pay overtime the whole week to get that covered? Well, my response is you can't afford not to. I mean, look what happened to law enforcement this last 12 months. Look at the defunding, the riots, everything is just gone incredibly out of control. And so the time is now. The conversation is now. I used to say CIT was the future of policing. The CIT is the now of policing, and you have to make it a priority.
So here in the state of Maine, there is an academy mandate that 20% of all police departments be either mental health first aid certified or CIT trained. And so it's either or. Since 2015, our police academy has implemented mental health first aid training, which is an international evidence-based training into the academy. And so every recent graduate of the police academy ends up receiving that. When the question was asked, I could see both Eliot and Jamie's faces. Everyone kind of smirked because mandated CIT training is blanket CIT training is a very hot topic down in our region. And so they're giggling now. It's actually recommended by the International Association of Chiefs of Police to 100% be mental health first aid certified and then 20% be CIT trained. We go back and forth because we want to have all of the officers properly trained and trained in the best means possible. But CIT is meant to be a specialty. And so what we're really working on in the different regions is how do we get quality training to as many officers as possible, while still keeping the CIT specialty part of it, because we don't have the specialty units. And so how do we kind of balance that all out and negotiate that all out? And so it is definitely a work in progress here in Maine. And we have had lots of negotiations and meetings and discussions, and everyone's kind of giggling because we've been going back and forth about how to best implement it. Again, we're in a rural community with limited resources. And so how do we best implement it and get creative with it? And I think we're going in the right direction, I think.
Well, this has been, you know, a wonderful, I guess it's probably just the beginning of the conversation, right? In reality, as we learn about this, but it just, you know, a big thanks first and foremost to Ernie for coming out and supporting this, and for doing all the work that you've done, and also documenting it all. And so I think this is an incredible resource, and you'll have access to the video for a period of time, the full video for a period of time as well. And of course, thanks to Chief Moya and the Eliot Police Department, and thanks to NAMI Maine, and thanks to Jamie and Sweetser. We'll be sending out an email with resources, as well as hopefully answering the many questions that we didn't get a chance to answer the best that we can. I'm gonna go ahead and share this sort of closing documentation. So if our panelists want to disappear and say goodbye to everyone. And I will share a little bit here. So, you know, we would like we would like any U.S. law enforcement agency in the webinar tonight to know that Ernie and Joe Crisis Cops is now available for free, streaming through May of 2022. To take advantage of this offer, please go to the film's website. That's ernieandjoethefilm.com, and click on the yellow banner at the top. The film is also available to the community mental health organizations such as NAMI chapters through June. And to do that, you can email enjoutreach@gmail to request a screening such as this one. Also, some local information here as well. The Maine crisis line, NAMI Maine, of course, and the Eliot Police Department. So we want to thank you all so much for coming out. We'll be in touch again through email, and continue the process.